As the government tries to balance how to control the spread of coronavirus and send Indians back to work, it has come up with the mantra of minimum mobility and maximum work for the post-lockdown period. As per media reports, although the centre has not yet finalized whether the coronavirus lockdown will be extended, there have been several discussions to operate. As per media reports, although the centre has not yet finalized whether the coronavirus lockdown will be extended after May 3, there have been several discussions to prepare a roadmap to revive economic activity, as the drastic measures to control coronavirus have sent the economy into a tailspin and hit the poorest sections hard. Meanwhile, in India, the COVID-19 cases crossed 23,000 mark while the death toll rose to 718 this morning, according to the Union Health Ministry data. With the virus taking a toll on the economy, the Union government is weighing options for a stimulus to protect wages of workers employed in micro, small and medium enterprises as the sector fights a survival battle. The death toll from coronavirus pandemic worldwide rose by over 4,500 to 1,86,462 over the past 24 hours, while the number of COVID-19 infections increased by 68,017, according to an AFP tally. Amid much speculation, Oxford University had yesterday begun human trial of a potential coronavirus vaccine. If the trial emerges successful, the vaccine will be available for the public by the later part of this year. According to a report, more than 100 research projects around the world to find a vaccine, 7 are currently in clinical trials. Nicotine could protect people from contracting the coronavirus, according to new research in France, where further trials are planned to test whether the substance could be used to prevent or treat the deadly illness, a media report said. The findings come after researchers at a top Paris hospital examined 343 coronavirus patients along with 139 people infected with the illness with milder symptoms. A man from Manipur was found dead under suspicious circumstances in Shivaji Nagar of Bengaluru. According to the report, the deceased has been identified as Amir Elias Angau, son of Savir of Mayang Imphal Bengun Leira Achoba. He was studying in Bengaluru. Details are awaited. Manipur Assembly Speaker Yumnam KHEMCHAND today described the current situation a battle between human and the deadly coronavirus. He was taking part in distribution of relief materials at the Model Club Sinjamai Chingamakha in Imphal. The speaker underlined on the need of maintaining social distancing and stay indoors norm in the fight against the COVID-19 pandemic. Relief materials have been distributed to the people for the 4th time in Sinjamai constituency, he added. Food items were also distributed to media persons at the venue. UKHRUL Autonomous District Council has begun distribution of first phase of relief materials to public at its office premises. Rice, potatoes, eatable oil, salt, organic vegetables and masks were distributed to 9 charity homes run by local clubs and societies. During the distribution function, the Autonomous District Council Chairman appealed to the people of UKHRUL to start paddy cultivation. The Chairman also thanked the Autonomous District Council staff for donating their one-day salary. A 4-month-old baby infected with COVID-19 passed away in Kozhikode of Kerala today. The baby was admitted to Kozhikode Medical College and was tested positive for the virus yesterday, according to reports. The child was undergoing treatment for heart-related problems for the past 3 months and had pneumonia. Malappuram District Medical Officer informed this morning that the 4-month-old baby from Malappuram, who had tested positive for COVID-19, lost her life early this morning at Kozhikode Medical College. The US House of Representatives overwhelmingly approved a $484 billion coronavirus relief bill, funding small businesses and hospitals and pushing the total spending response to the crisis to an unprecedented near $3 trillion. As per a report, the measure passed the Democratic-led House by a vote of 388-5, with 1 member voting present. Lawmakers wearing masks approved the bill during an extended period of voting, maintaining public health recommendations. The $484 billion aid bill was the 4th passed to address the coronavirus crisis.